Hemorrhagic shock is a clinical syndrome which results from the loss of the blood due to trauma or an injury. It can be either internal or external depending on the source of the bleeding. First of all, look around and check for the surrounding. Make sure the scene is safe and call for the ambulance for the help. And do not forget to wear the personal protective equipment for your own safety.
Hey, what happened? Bike hit and run away. When did it happen? Then, what's your name?
In this situation, we don't need to open the airway since patient is breathing and talking, and we'll proceed to checking the vital signs of the patient. We'll assess the pulse rate, breathing rate, and the heart rate of the patient. And the pulse rate is 120 and the breathing rate is 28. And we'll measure the blood pressure, which is right now 100/70. And the patient has tachypnea, tachycardia, hypotension, and the skin looks pale and clammy. And also, there's external source of bleeding on the right leg of the patient. And all these signs shows the third class of hemorrhagic shock, and the condition of the patient is unstable. The goal is to stop the external bleeding and replenish the lost volume and maintain homeostasis. To stop the bleeding, first of all, clean the wound with the antiseptic solution, then apply pressure with the gauze pad, and then roll the bandage. To improve the blood circulation to the heart, raise the lower extremities of the victim. Loosen the tight clothing of the patient and open the window so that fresh air can come in. While transporting the patient to the hospital, we'll begin with the administration of the fluids through IV line. For that, we'll make an IV cannulation at cubital fossa. We will administer 2 liters of crystalloid solution such as lactate or normal saline over the span of 20 to 30 minutes with the ratio of 1:3 to the predicted lost volume of blood. But we also need to be careful because over resuscitation with the crystalloids can lead to coagulopathy and acidosis. Once reaching the hospital, our main priority is to get the patient blood transfusion as soon as the possible, and for that we'll begin with the necessary lab test and the cross matching and get the blood transfusion done. But in case of emergency, when there's no time to do all the necessary procedure, we may administer negative O blood in very small amounts.